Cambodia is a lower middle income country located in East Asia and the Pacific according to World Bank. Life expectancy is 68.98 years. Furthermore, Cambodia has a lower HDI value compared to other surrounding countries.
Demographic transition has 5 stages. Cambodia is in the second stage of demographic transition and is approaching the third stage. The second stage is characterized by low fertility rate, low mortality rate, a deceleration in population growth, and an increase in life expectancy. As the influence of communism began to diminish in the late 20th century, non-communicable diseases as well as injuries decreased, while communicable diseases remained steady.
Disease burden is the impact of a health problem as measured by financial cost, mortality, morbidity, or other indicators. It is often quantified in terms of QALYs and DALYs. 64% arises from non-communicable diseases, which are genetically predisposed conditions such as diabetes. 26% arise from communicable diseases, which are transmitted diseases such as HIV, and 10% result from injuries in general.
The Disability Adjusted Life Year DALY is a measure of overall disease burden. Expresses the number of years lost due to ill health, disability, or early death. The top 3 causes of death are lower respiratory, stroke, and ischemic heart disease. Lower respiratory accounts for 39%, stroke approximately 19%, and ischemic approximately 21%. These diseases affect various populations of Cambodia. Lower respiratory mainly affects the 0 to 14 age demographic, while stroke and ischemic heart disease are most common in the older demographic. From a socioeconomical standpoint, these diseases are especially prevalent with the lower income group. The most common prevalent disease in Cambodia is lower respiratory infection, which is a communicable disease. It is caused by bacteria and virus infections in the lower respiratory system and leads to serious health issues. The main causes of this infection are smoking tobacco and air pollution. This disease is highly transmittable in public areas such as transit, schools, and other crowded places.
A stroke occurs when blood flow to the brain is stopped. 2 common causes of strokes are cerebrovascular disease and cardiovascular disease. They are both non-communicable diseases. Cerebrovascular disease is a leading cause of hemorrhagic and ischemic strokes in Cambodia today. These diseases are mainly caused by hypertension, high blood pressure, smoking, high blood cholesterol, diabetes, and a lack of exercise.
Ischemic heart disease is a leading cause of death in Cambodia and is also considered as a non-communicable disease. The main cause for IHD is plaque buildup in artery walls. The plaque is usually made up of fat, cholesterol, as well as other substances in the blood. The plaque buildup in the inner wall of the artery causes it to narrow, which in turn allows less blood flow to your heart, which causes heart attack.
Health-related organizations can help lobby the government to reduce air pollution by raising the regulation on manufacturing factory emissions and imposing air pollution emission tax. Increasing healthcare access and health insurance plans can ensure all of the medical demands are met in a timely and efficient manner. One plan to prevent the infection caused by this disease is to reduce air pollution. Another plan is to promote the bad influence on smoking tobacco, since smoking is one of the main causes of pneumonia. The government should also educate people about the symptoms of lower respiratory infection so that they could seek treatment as soon as possible. The earlier the patient see the doctor, the less chance he or she will be killed by the disease.
Strokes are behaviorally and metabolically caused. Thus, our option for action is implementing a healthier lifestyle through a better diet and exercise. The government can invest into public care facilities and into recreation. Developing public care facilities will provide fundamental care for many common diseases and prevent cerebrovascular disease. This can be done by improving the overall quality and safety of current healthcare services. The government could work towards making vaccinations and medication more accessible. The government can also invest in recreational facilities, which can provide the resources to encourage and educate people about the importance of physical wellness. Recreational facilities would also address several challenges like high blood pressure and stress, which are major causes of strokes.
The government of Cambodia can implement various proposals for decreasing the case of ischemic heart disease. Cambodia can create rehabilitation centers for individuals at high risk or already are diagnosed with IHD. These rehabilitation centers would be created for educational purposes, which teach individuals how to take care of family members with IHD or individuals wanting to learn how to take care of themselves. The centers would be filled with cardiologists and nutritionists would also create personal plans for patients that would cater towards the individual's need. Also, unhealthy activities such as smoking, drinking, and bad eating habits are directly linked with IHD. The government can create regulations against the production, sale, and distribution of alcohol and unhealthy foods, which would decrease plaque buildup in individuals' arteries, which in time would lead to ischemic heart disease.
Cambodia faces a number of barriers in carrying out the plan, such as financial, transportation, and cultural. Facilities in Cambodia can hardly maintain all the patients, lack funds to buy equipment, and lack trained personnel and medical resources. This all leads to improper treatment.